name's Chandler, and today I'm going to be doing my skills check-off on how to perform trach care. So first I'm going to verify the orders that trach care is needed, and then I'm going to go ahead and wash my hands for 15 seconds, grab some gloves, and enter the patient's room. I'm going to introduce myself to the patient. Hi, I'm Chandler. I'm here to do some trach care on ya. I'm going to verify the patient's identity, name and date of birth. I'm gonna look at the trach and just see what I see. I see that the gauze underneath the trach is soiled and needs to be changed, and that there are secretions in the trach. So those are my two indicators of why we need to do trach care. Before I begin, I'm going to assess my patient. I'm gonna hook them up to a vitals monitor so I can monitor their heart rate, their oxygen levels, and then I'm going to listen to breath sounds. I'm going to go ahead and do that. You can also hear some little crackles in the chest, so that's another indication that we need to maybe suction the patient because they got some gunk in there. So I'm going to go ahead and I'm going to open up my trach care kit and get my materials ready. So first I'm going to lay my cover down. Then I'm going to dump my materials out. So I have that guy sitting right there. I have this one right here. And I'm going to remove my gauze and put it over here. Oh, stuck to it. I'm going to fill these containers with sterile water, and I'm going to place the brush for the inner cannula in that water. So first I'm going to go ahead and I'm going to loosen this up just a little bit so we can make sure that the patient still can have adequate oxygenation while we're performing trach care. Put it like that, 2 degree. All right, so then first I'm going to remove the trach. I'm going to unlock it. I'm going to place it in my sterile water and let it soak. And then I'm going to go ahead and remove the dirty gauze. While I'm doing this, I want to inspect my patient. I want to look at the skin, the stoma, see if there's any redness, any irritation, look for signs of infection. I'm going to throw this away. I'm going to dip this in my sterile water and I'm going to clean it. I'm going to make sure that the oxygen mask is near the inner cannula so the patient is still receiving oxygen, and I'm going to clean from the inside out. Like inner, work my way out, circular motions. Make sure that everything looks good. At this time, these do not need to be changed because they are not wet and they are not soiled. So as of right now, our main concern is just the inner cannula, not the straps holding the trach in place. So I am now going to put on my sterile gloves because we need to clean the inside of the inner cannula and then prepare to suction the patient. I'm going to do the double glove method. Okay, so I'm going to start with my right hand. Sterile gloves are just not friends. My one finger is stuck. Now I'm going to use these to prepare my other glove. Okay, so we are ready. So I'm going to pick up my inner cannula. And I'm going to wash it, get the gunk out, then I clean it off, shake it, let it dry, and then we're gonna go ahead and we're gonna put it back in there, slide it in, we're gonna lock it. Okay, so we're gonna suction the patient because the patient had secretions. Okay, we're gonna plug this into the wall. And then we're gonna suction with this. So we're gonna go down, and then we're gonna occlude and come up. Okay. And then we're going to put this on our patient. Gonna do it very gently. And then we're going to put that back on. All looks well. Patient looks well. Gonna reassess vitals, and document everything that we did today and dispose of my trash. I feel like I still did that wrong, but it's okay.